Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. Did you know that up to 1 in 15 people in the United States will develop a brain aneurysm? 10 to 15% of these patients will die before reaching the hospital, and over 50% will die within the first 30 days after rupture. To learn more about brain aneurysms, we are joined by Dr. Rodney Routsong, a neurosurgeon with the Jones Clinic of Northwest Arkansas. Dr. Routsong, welcome to the show. Thank you for being here with us today.
I'm very happy to be here.
Tell us, what is a brain aneurysm?
Brain aneurysms are weak places in arteries in the brain. Most of them assume the shape of kind of like a blister on an old-fashioned inner tube. And the blister portion of the aneurysm is very thin, producing the possibility of rupture and intracranial bleeding.
So how many different types of shapes are there, Dr. Routsong?
The most common shape that we see are called berry aneurysms. Some of them have stalks on it, sort of like a Tootsie Roll pop. Others have broad bases on it. Another type of aneurysm we see are called fusiform aneurysms, and those assume kind of a spindle-like shape in the wall. And the third type of aneurysm we see are called mycotic aneurysms. These involve small distal blood vessels in the brain, arteries in the brain. And again, these are weak spots in the artery.
And you said the berry aneurysm is the most common, is that right?
That's correct.
Okay. What causes brain aneurysms, Dr. Routsong?
Well, years ago, we used to think that people were born with them. But after multiple series of autopsies on children and babies, we found out that that's usually not the case. The reason for these would be called what we call developmental aneurysms. In other words, after years and years of hardening of the arteries and high blood pressure, weak spots develop in the artery wall, usually at a bifurcation of an artery. And then these weak places substantially grow as the decades go by and get larger and larger.
I see. Now, what are the risk factors for brain aneurysms, and are some people more prone to them than others?
Yes, that's true. The risk factors are basically the same as the risk factors for heart attacks and strokes. First is hereditary, a family history of that. In the case of aneurysms, most aneurysms we see do not have a family history of aneurysms. The other risk factors are things that we can work on. And again, this is not only for aneurysms, but for heart attacks and strokes. Number one on the list is uncontrolled high blood pressure. Number two is cigarette smoking. Both of these advance hardening of the arteries, atherosclerosis. Number three is uncontrolled diabetes. And number four, incontrollable things, would be high cholesterol levels. And again, that all goes into progression of hardening of the arteries. There are other risk factors that I think are very important, especially in our community here. People doing cocaine and people doing methamphetamine are at increased risk for developing intracranial aneurysms.
I see. So it's safe to say that some of it is preventable. If you watch what you eat, watch what you put in your body, not smoking, not using drugs, that can help prevent brain aneurysms, but yet there's still that component of genetic, hereditary factors.
Yes, but again, the genetics figure more into the other types of strokes and in heart attacks. In the case of aneurysms, there were multiple mechanisms for strokes, and aneurysm formation is probably number 4 on the list for types of strokes.
I see. What are some of the symptoms that you would see in someone who's developing a brain aneurysm, or if one has just ruptured or they're about to rupture?
Well, for the most part, people with unruptured aneurysms have no symptoms from that. There have been several series that have shown that if an aneurysm, depending on the age of the patient, is 7 millimeters in diameter or less, that the risk of it bleeding is much less than the larger aneurysms. People that have aneurysmal bleeds are terribly sick. They present with the worst headache they've ever had in their entire life. Oftentimes they're vomiting. Frequently people come in coma. They're unresponsive.
Does trauma play a role in this type of brain aneurysms that you were mentioning earlier? Like if you get in a car accident or hit on the head, that make one of the blood vessels burst, obviously?
No, trauma usually doesn't play into this.
Okay.
And as far as why people have spontaneous hemorrhage, a lot of them have high blood pressure, but some of them have perfectly normal blood pressure. We used to think they only occurred under stress in the daytime. I've had multiple patients that woke up with a terrible headache in the middle of the night. So trauma, by and large, doesn't have much to do with that.
I see. Dr. Routsong, when someone says, I have had the worst headache of my life, that would make you think of a brain aneurysm or maybe an early hemorrhage that's about to happen. Are there any other signs or symptoms that would make you think, oh no, I need to do some imaging or do some sort of testing to see if there's an aneurysm that is present or about to rupture?
Usually not. The exceptions to that, if the patient or their family is very concerned about that and there's a past history of other people in the family having aneurysms, well, certainly peace of mind is worth a lot to patients, so I would do studies in that situation. On rare occasion, people have some subtle symptoms without the terrible headache. There are some aneurysms of the internal carotid artery, for example, that may press on a nerve behind the eye. And if there's pressure on the eye, well, then the patient has double vision and the pupil dilates.
I see.
But that's, I've only seen that maybe 2 or 3 times in the last 35 years.
Really? Are there some other subtle symptoms that are common that you would see?
Usually not.
Usually not.
For the most part, with our fancy scans now, it's not unusual for me to accidentally diagnose an aneurysm. I'm looking for something else, and there happens to be an aneurysm. It's said that approximately 2% of people at autopsy have unruptured aneurysms.
I see.
On a national basis, the figures run that we think that on a yearly basis, about 400,000 Americans have unruptured aneurysms, and about 26,000 of these actually have a bleed per year.
I see. Have you found that someone with a brain aneurysm might have an aneurysm somewhere else in their body, like an aortic aneurysm, or are they unrelated?
That would be unusual.
Yeah.
The examples of that would be what we call syndromes. Syndromes, patients have not just one symptom, but a whole group of symptoms that run through the family. An example of that would be Marfan syndrome, like Abraham Lincoln. He had funny-looking cataracts. He may or may not have had a brain aneurysm, and he may or may not have had a aneurysm in the aorta. There are other connective tissue disorders, such as Ehlers-Danlos, that sometimes these people have a higher tendency to have aneurysms.
I see.
In the case of patients having bona fide neurosyphilis, one of the forms of that's called meningo vascular syphilis, and these people can also form aneurysms.
I see. Tell us some of the tests and tools that you use to diagnose a brain aneurysm.
Well, the most valuable tools that we have are our modern scans. On an emergency basis, if there has been a subtle ooze or bleed from an aneurysm, that's readily seen on a CT scan. The primary tool, the gold standard, is formal cerebral angiography. With that, we pass tiny catheters up the aorta and then selectively do dye injections in the arteries that go to the brain. In recent years, however, we have new computer techniques to actually do the angiography with computer manipulation of either a CT or an MR scan. That is very quick to do. It's very easy to do. In the old days, when I did my own cerebral angiography, if I had a patient with an aneurysm, I'd have to do an angiogram in the middle of the night and they'd be ready to operate on them the next morning. Wow. So these wonderful computer programs are just a blessing from God when it comes to diagnosing aneurysms.
I agree with that. So the treatment options are surgery. What other treatment options are there, Dr. Routsong?
Well, there are 3 possible ways to manage these. In older patients, for example, that have small aneurysms, or Mother Nature's already thrombosed them, has already clotted them off, they have major heart disease and all of that, they're 75, 80 years of age. If they've lived 80 years without an aneurysmal rupture in that setting, you just watch these people and control their blood pressure.
That makes sense.
The standard of care until recently has been aneurysmal clipping. With fine microscopic dissection techniques underneath the brain, we have these little microvascular clamps. We call them clips. And when I talk to patients, I try not to use the word clip because the patient thinks, oh, you're just going to cut it off. No, we don't cut it off. But what we try to do is to isolate the thin part of the aneurysm dome from the main artery there without cutting off the main artery. If you accidentally clip the main artery, then you cause the patient to have a stroke. The more modern approach that I will go through in just a bit is what we call coiling.
Okay. Coiling. Now, Dr. Routsong, are there any new studies or research out there that are showing any advancements in diagnosis and treatment with brain aneurysms?
Well, by far and away, the most recent advantage that we have are fancy computer programs to do angiography in either the CT scan or the MR scan. Other advances that we have are coiling. Now, with coiling, we do like a formal angiogram. We pass a tiny catheter up the aorta and selectively select the blood vessels in the brain where the aneurysm is. And then we have this microfine wire that we carefully pass up to the catheter and coil this wire in the dome of the aneurysm so that it will clot off and seal the aneurysm. We've been doing that for several years, but in recent years, the techniques for that have really become extraordinarily good. I have friends that practice neurosurgery in Detroit, and in the Detroit area, I've been told that approximately 90% of aneurysms get coiled there instead of going to surgery.
All right. Well, Dr. Routsong, why is it so important to raise awareness about brain aneurysms and the potential of brain aneurysms?
When aneurysms bleed, it's always devastating. The mortality rate in a ruptured aneurysm that's not been repaired is about 75% in the first 6 months after the initial bleed.
Mm-hmm.
When I talk about a bleeding aneurysm, I tell patients that I'm not talking about ongoing bleeding. The actual bleeding occurs maybe 1 or 2 seconds, and then Mother Nature plugs up the hole. But the problem with the bleed, if there's what we call eloquent cortex next to that, then that can be destroyed. That causes a major stroke. People are paralyzed. People can't talk. People may be in coma the rest of their life. So the importance of this is knowing that this is a major health problem. It is devastating, if not taking the patient's life, and that prompt and early diagnosis is the key to giving these people some hope.
And living a healthy lifestyle can also help prevent that.
Absolutely.
All right. Well, Dr. Routsong, thank you so much for being here today with us. We appreciate it.
It's been my pleasure. Thank you.
Family Health Today. We'll be right back.